Are you newly diagnosed with MS and being asked to pick a drug? Stay with me to the end and I'll give you solid tips on what to say that gets your MS team to guide you to the right medicine without putting the burden of choice entirely on you. One thing still shocks me though, hearing about people being handed a menu of MS drugs and told, choose one. We're not neurologists. Early inflammation chips away at your reserve, your functional reserve. And even when you feel fine, damage is happening. The goal now is to suppress disease activity to protect the future you. That's why the current thinking centers seem to push treatment hard and early. There's a reason. To start with a highly effective therapy when the disease is most modifiable gives you the best long-term outcomes. Drop a line in the comments if you want to learn more about this data, because I'm happy to share it. The long and the short of this is that the big data sets from multiple MS registries consistently back earlier, stronger control as a strategy to preserve your brain function. I'm 34 years into MS, thank God I got some decent advice. Your team should translate your MRI relapses, your lifestyle, your risk tolerance, and your long-term ambitions into a clear recommendation with a plan to prevent, monitor, and manage side effects, as you'd hope from medical professionals. That is shared decision-making done properly. So I told you I'd tell you what to say to them in the clinic, because some people tell me they're not sure what to say. So here's the ask that you use with your neurologist or your MS nurse or all together. Given my MRI history, please recommend the most effective therapy you'd choose from me today to manage this disease in the long term, and explain how we'll monitor and manage the risks of any medicine. And please put that recommendation in my clinic letter. Make them write it down. Then add, there's two more short things. What's the expected benefit for me if we start this now versus later? And two, how will we track success? And when will we switch if it's not working? Because that's an option. There's lots of meds out there. So don't forget, ask for guidance, not a menu. Let your priorities drive the choice, but let their expertise land the plane. That's how you balance effectiveness for the side effects and for the long run. I'm Dominic. I've had MS for 34 years. I've been on 5 different DMTs and I work in the field. So follow me for more credible information.